Hey everybody, it's Debbie Heiss Lambert reaching out to you today about gadolinium deposition disease, gadolinium toxicity, GDD, and chelation. I want to talk today about chelation. I get a lot of people calling and reaching out to me, texting me, reaching out in the support group, which we're getting about 450 new members every single month. Who have been injected with a gadolinium-based contrast agent and or are scheduled to be injected, and they're wondering if they should do it. And just asking questions about this toxic rare earth metal that is still being injected 30 to 50 million times annually, even though the CDC now has a statement that says even in small amounts may be associated with significant morbidity and mortality. And then a few years ago, 2018, the manufacturers did release a letter saying that they did acknowledge that it is retained in the brain, the bones, the tissue, and the organs, but that was as far as they went, other than acknowledging that the only disease state at that time that they recognized was NSF, which is nephrogenic systemic fibrosis, which they thought was only associated with people who had bad kidneys. But now we know that gadolinium iatrogenic fibrosis is a real thing, and that's why the pathway I'm headed down right now. I have fibrosis in my heart and in my lungs, and I'm going to see a kidney specialist in July to talk about kidney and liver problems. So is it the gadolinium? We don't know, but none of these problems started. I was perfectly, I had pancreatitis, but I would have lived with that over this any day. But that's my reality. Is here we are 7 years out, and I'm chasing this and chasing that and trying to figure out if it's this toxic rare earth metal that's retained in the body. But chelation's an option. One I get people pinging me all the time about and asking me, did it help you? What were the downsides? What were the upsides? What can you tell me about it? Because I'm considering doing chelation. Would you do it again? All of those questions. And so I thought, well, I'll just do a real quick video. It kind of answers the questions. I can post it and I can point people to this video who are asking the questions, is chelation right for me? That has to be a personal decision, right? Just like you may not have been informed before you were injected with the contrast agent, you really want to be informed, and you want to do your homework, and you really want to ask the difficult questions, and you want to work with someone who really understands the pros and cons of heavy metals and heavy metal toxicity and chelation. It has helped me. It helped me. Are there downsides? Yes, probably so. I'm going to just talk about a few things to consider if you're a patient and you're looking to do chelation and you're wondering if it's right for you. For me, I didn't really feel like I had any other options. I was pretty sure I was dying after 4 injections of gadolinium contrast agents. The first one induced dementia-like symptoms. I was injected because they were looking at my pancreas, but it immediately following, I did get dementia-like symptoms and couldn't find my way to my job, my dog park, the grocery store, and my whole life turned upside down. My job was at risk, and I did lose my job. I did have to retire from my job. I couldn't go from meeting to meeting and be productive and be the high-level producer I had always been. So it was problematic. But I did do chelation. I did 12 treatments of calcium, zinc, chelation. And I would say if you want to know more, go to Google and go to Dr. Samalka, Richard Samalka. Go to his blog and read his blogs. He writes about chelation. He's written lots of books. He's a radiologist who's spending the second half of his career helping gadolinium toxic patients with chelation protocols. At the same time, so go there. He also has a nonprofit called gadtrack.org, and they can help you find a chelation specialist, because you don't want to just do a DIY, and you don't want to be doing chelation unless the doctor or the person that you're working with is trained and really understands heavy metal toxicities, because it is a controversial topic. And why is it controversial? Because we don't really understand how there's a lot of discussion now about redistribution and how the binders grab it but don't pull it all the way out of the body. And then if they do pull it all the way out of the body, they're also taking out other helpful and healthy minerals that the body needs to function and maintain and be in homeostasis, right? So there's risk factors, and that's true about all of anything we do in the medical world for our bodies. Any drugs we take or reactions or surgeries or any of that, there's risks associated. I think the biggest unfortunate part about gadolinium deposition disease or gadolinium toxicity is that 91% of people in a recent poll in a group said that they were never given informed consent or told anything about gadolinium, or that it was toxic, it was a toxic rare earth metal, or anything. They just weren't told. And then those who were, we were told when I was getting it, and I did ask, I think during the fourth injection, after, I don't know, I don't remember when I started connecting the dots. It was not until like the fourth injection. But they just don't give you enough information. So informed consent's still a problem. We see that every day in the gadolinium group. And transparency and truth about the fact that it's a toxic rare earth metal. And even to the fact that this last week I met with a cardiologist to talk about the fibrosis in my heart and lungs, and they didn't want to talk about gadolinium. They didn't want to acknowledge or have that conversation. So it's problematic. We need to get there, and we will. I mean, the groups are growing so rapidly right now, and people are asking questions. But back to chelation. Chelation was helpful. So research Dr. Richard Selmalka. Google his name. He's got a blog. He's got a organization, gadtrack.org, which is a nonprofit, and he and his clinic there can connect you with people in your area who specialize and are trained in chelation therapies. There's all kinds of binders. The thing you need to know about chelation binders is they're very specific. They're like claws, and they have a very specific match to a foreigner that is in your body that they're trying to grab and pull out. And they're not every binder works with every foreigner that's in the body. They're very specific. So there's all kinds of chelators and different products out there. Charcoal's one, DMSA, DTPA, EDTA, all kinds. There's all kinds of different binders, but you need to know which binder works with the product that you're and the foreigner that you're trying to get rid of, because that makes a big difference, right? Even if the fact that it can grab onto it, it might not hold onto it long enough to export it all the way out of the body. Escort, it was the word I was looking for. That's the dementia leftovers. But to eradicate it all the way out of the body. So you need to know the binders. You need to know the chelation products and what is what and what is matched to what foreigner, because it does matter. There's silica products out there, all kinds of things. And when you're working with a specialist, they can really talk about the pros and cons and the upsides and the downsides. And that's what you want. You want education. You want transparency. You want informed consent of knowing what you're putting in your body. And that's not happening with the contrast agent all the time. They're just not, it's just not happening. We have a gap. Let's just put it that way. So chelation, back to chelation. Chelation, people ask me all the time, did you do it? Did you like it? Did it help? Blah, blah, blah. Would you do it again? I am a proponent. I'm a proponent because I really thought I was dying after gadolinium-based contrast agents were injected. And so my level and the levels change, because as we normalize gadolinium, the more people we inject, the more people who have it retained. And there is a letter from the manufacturer saying some amount is retained in everyone who's injected. It's retained in your brain, your bones, your tissue, and your organs. So retention is known and is acknowledged. And then NSF, which was the first diagnosis that was out there, stands for nephrogenic systemic fibrosis, and that's was related to kidneys and thought to be only people who had compromised kidneys would be impacted by that. But now we know that's not true. We do know, I think the term that we use now is gadolinium iatrogenic fibrosis. And even me, I have fibrosis in multiple organs. So I may have already said all of this, but let's keep moving. So chelation. It's expensive. It's out of pocket. insurance doesn't pay to do this protocol. And I don't know why. Maybe because they don't think it's helpful. Maybe they think it's too risky. I don't know. I do know the military uses DTPA, and DTPA is a ligand that's wrapped around the original gadolinium for some brands when it's being injected in the body. So I'm not sure why, and it may have to do with timing, that you would have to, chelate it right away versus waiting, and then it settles, and then you put the chelator in and it stirs it up, and then it's raking it out the body. There's like so many things that you just don't know, and because no one's doing the research or reporting other than the people who are doing the chelation, which I'm thankful for and I'm grateful for, and I will always be a proponent of chelation, even with all this controversial topics that we're talking about. But I would say if you're the patient, you need to have a confidence level and understand the risks and be willing to take those risks if you're going to try it. It did help me. It did help with my cognitive. It helped with some of the pain. But I did get new and worsening symptoms in other areas. And now 7 years later, we're seeing fibrosis and something wrong in every single organ. What part did chelation play? I don't know, if any. And what part is the heavy metal playing? No one knows, because no one's studying it. And that's the sad part of this whole kerfuffle. But we'll get there. We'll get there. Lots more people are asking questions, so that's good. Okay, chelation. It's expensive. You have to travel. It's not covered by insurance, and there are pros and cons. A lot of times, because you're moving it up and you're stirring it up and it's moving around, you feel worse initially. And sometimes for a few days, sometimes for a few weeks. It's hard to know. Everyone's different, and everybody's body is in different levels of homeostasis, so it's hard to say how one person will react versus another person react. The other thing I would say about chelation is if you have other metals in your bodies, look up the word galvanic corrosion, because other metals such as metal plates, screws, clips, body parts even, right? Body parts that are made of metal, if you inject a chelator, the chelator is going to go after the metals. It knows that's what its job is. It's like, hey, there's a metal. I'm going to grab it and I'm going to take it on out of here. But it can't do that to a clip or a screw or a plate. And so you're setting yourself up for failure. So I would say do not, or at least disclose and have that conversation. So, doctor, I have metal screws, I have a metal plate, I have a metal body part. Have those conversations, because I would say it would immediately disqualify you from being able to chelate. And then the whole thing of the mineral deficiency, which I think I touched on, the biome of the stomach, so you're not absorbing minerals, and then the chelator's pulling the good minerals and the bad minerals. It doesn't know the difference, and so it's just pulling all kinds of minerals out of the body. How are you replenishing those and supporting the immune system so that it doesn't go into fight and flight and set off a whole new host of other issues? Those are all questions that you want to have and discuss with your medical professional before you sign up for chelation. I'll remain a proponent, even with all the new and worsening symptoms and the unknowns I have. I've had, several years of being able to think where I couldn't before. So for me, chelation was a rescue. It was a rescue for me. And I'm thankful for it. And I give all the glory to God that every day I'm able to get out of bed. And some days I'm not. And I spent 11 months in bed going back to school to learn about how the body parts all work holistically and how messed up this whole thing is, and that we're not treating the body holistically anymore. And we're going to doctors for specialized medicine, and we're not looking at the whole body parts. And our body works together, homeostasis. The body parts are all talking to the other body parts, and that's no different with chelation. You're going to put in a binder and it's going to just run through the body and it's going to go through the bloodstream and whatever, and it's going to just try to help you get well, but it could make you worse. I don't know. I don't have those good answers. So do your homework. Know what you're injecting, what you're inhaling, what you're ingesting. Toxins of today are nothing like toxins of previous time periods. And we're living in a toxic world, and people are sicker than they've ever been. And we need to understand root causes. And I hope that that's the direction that we're headed, because that will allow us all to live in a much healthier life and much healthier world. So I'm going to end. Know that it's not covered by insurance. There is no approved one, even though DTPA is used by the military and they use it for chelating toxins. So that should give us some comfort, I guess. And that you could be sicker and you could get well and you could have new symptoms or worsening symptoms. And there's just too many unknowns to really know, but it has to be your decision, okay? So hang in there. May your journey be one of wellness always, and take good care. Bye.